When able.
Our video is not visible, ma'am.
So it's 3, 2, 1.
Oh.
We are live now. Over to you, ma'am.
Hello. Hello. Video is not visible.
Dr. Aishwarya, our video is not actually visible.
Team C, if you are not visible, you can rejoin the meeting.
Rejoin cheyachu.
So all are visible. Done.
Good afternoon, one and all. Welcome to the 6th Annual State Conference, AFPICON 2022 of AFPI Kerala Chapter. Now we have the quiz finals. We have 5 teams. Team A, Dr. Nasiba and Dr. Fatima from KIMS Health Trivandrum. Team B, Dr. Minnu and Dr. Anaka from Lutz Hospital, Kochi. Team C, Dr. Ashwati and Dr. Naveena from Lutz Hospital, Kochi. And Team D, Dr. Labiba and Dr. Krishna from Medical Trust Hospital, Kochi. And Team E, Dr. Jitin and Dr. Aparna from KIMS Health, Trivandrum. So at the onset, let me thank few people who have been the backbone in setting the quiz. Dr. Bindu for setting the questions, Dr. Zarin Madam for compiling and editing the questions, and Dr. Sarin Kuriakos sir for the technical assistance in preparing the PowerPoint presentations. My name is Dr. Aishwarya and I will be the quiz master. Also, please note that there will be you will be given 30 seconds for a direct question and 15 seconds for a past questions. For a question that has been passed, you will get 15 seconds, and for a direct question, you will get 30 seconds. So let's move on to the instructions. There are 4 rounds. Please follow the instructions before each round. and the quiz master's decision is final. Now we move on to the first round. Round number 1. Here are the instructions. We start from team A. The team can choose your question number. No options will be provided. 10 marks will be given for the right answer. If a team cannot answer, the questions will be passed to the next team. The passing team also gets 10 marks for the correct answer. There won't be any negative marking. I hope the instruction is clear. You can choose your question, no options, 10 marks for the right answer. And if you cannot answer, you can pass the question, and the passing team will also get 10 marks for the correct answer, and there won't be any negative marking. Okay? So 30 seconds will be given for the direct question and 15 for the question that has been passed. 15 seconds. Okay? So team A, please choose your question.
3.
Question number 3. Team A. Team A has chosen question number 3. So the question is, what does this test indicate? Time starts now. What does this test indicate? Team A.
Ketone body. Presence of
What does this test indicate?
ketone positive, ma'am. Am I audible, ma'am?
Yes.
Ketone positive. Rothera's test, ketone body positive.
Okay, I hope team A has answered it. The answer you have given is Rothera's test for ketone bodies. Am I right?
Yes, ma'am.
Okay, so the answer is correct. It is Rothera's test for ketone bodies. I kindly request the answering teams to remove their masks. We can't see team E members. Okay, so team A has answered it correctly. Now we move on to team B. Please choose your question.
5. Question number 5.
Question number 5. Identify. Team B, your time starts now. Identify.
Normal.
Mid-arm circumference, the tape used to measure the mid-arm circumference.
What is the name? What is the name?
Shakir's tape. Shakir's tape. Did you hear me, madam?
Yes. Shakir's tape. 1 second. The answer is correct. It's Shakir's tape. So you get 10 points. Now team C, you can choose your question.
4.
Team C, 4. Question number 4. Right? Is it right? Please unmute.
Yes.
Yes, ma'am. Yes, ma'am.
Right. 4.
Question number 4. What is the interpretation of this graph? What is the interpretation of this graph? Your 30 seconds started now.
Restrictive lung disease.
Okay. Please say it clearly. Can you repeat?
Restrictive lung disease, ma'am.
Can you repeat once more?
Restrictive pattern.
You are saying restricted lung disease.
Restrictive lung disease.
Restrictive lung
pattern.
disease. Is that your answer? Restrictive lung disease?
Yes, ma'am.
Okay. I'm sorry. Okay. The question is passed. The answer is wrong. The question is passed to team D.
Obstructive. Ma'am, obstructive lung disease.
Okay. Team D, the answer is correct. It is obstructive lung disease. The answer is obstructive lung disease. Okay, now direct question to team D. Please choose your question.
Number 2.
Question number 2. Is that right? Team D?
Yes.
Okay, what is the level of transtubercular plane? What is the level of transtubercular plane? Team D? Team E is not visible.
Spinophilia.
I'm sorry, I didn't hear clearly. Team D?
Spinophilia twist.
What is the level of transtubercular plane?
Number
Level.
T7.
T7. Sorry, the answer is wrong. We pass the question to team E.
L1.
Team E is not.
Madam,
Our video is stuck, madam.
It's not visible.
Okay. Video is.
video is stuck, madam. We cannot see the screen.
Are we audible?
Team E, Dr. Jitin and Dr. Aparna, you're audible. But you're not.
No, I'm not able to see the screen.
Ma'am, you can swipe a screen. Team E.
Answer, madam.
Madam, we cannot see still.
Can you please swipe the screen and see?
We swipe, but it's stuck, madam. We can only hear you.
Then what is the level of transtubercular plane? You can hear the question. What is the level of transtubercular plane?
L1?
No, that is not the right answer. Now we pass the question to team A.
L5, ma'am.
What is the answer? Team A?
L5.
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 Yes. The answer is correct. Team A. It is L5.
screen in back. Home the screen in back.
Now we
Can you, team E, can you move
Now-
little
now we
backwards
can-
from the screen?
Now we can see, ma'am.
Okay, we can't see both of you. Can you please move the screen little back? Yeah, okay, now we can see. Okay. Now, team E, please choose your question.
Question number 1.
Question number 1. Okay. Which infection will cause an increase in this cell? Which infection will cause an increase in this cell? Which infection will cause an increase in this cell given in the diagram?
Infectious mononucleosis.
The answer is wrong. We pass the question. Team A,
Parasitic infections.
yes. Answer is correct. The figure shows eosinophils and it is increased in parasitic infection. So at end of round 1, we have the scores. Team A scores 30 points. Team B has scored 10 points. Team C hasn't scored any points yet. Team D has scored 10 points. And Team E also hasn't scored any points yet. Okay, so now we move on to round 2. Shall we move on? Okay. So first, we'll see the instructions. Round 2 starts from Team B. You can choose your question. Choose the right answer from the options provided. 10 marks will be given for the right answer and minus 5 marks for the wrong answer. There won't be any passing of questions. I hope it is clear. We start from Team B. You can choose your question. You can choose the right right answer from the options. 10 marks for the right answer, minus 5 for the wrong, and no passing of questions. If you don't
30
answer,
seconds for the, is it also 30 seconds?
yes, all the questions, direct questions will be for 30 seconds. If you don't answer, you won't get any points. Okay?
Okay. Okay, we have the option of not choosing an option.
Yes.
Okay, okay.
Okay. So I hope you're ready.
Yes.
So Team B, please choose your question.
3.
Team B has chosen question number 3. Please give the diagnosis. Option A, Colles fracture. Option B, Smith's fracture. Option C, Barton's fracture. And option D, Montague's fracture. We have 30 seconds. What is the diagnosis? Please choose your option.
C. Barton's fracture.
Sorry, the answer is wrong. There's no passing in this question. The right answer is Colles fracture. Colles fracture is the right answer.
See.
Now, team C, please choose your question.
Question number 1, ma'am.
Question number 1 for team C. Okay. Look at the diagram carefully. What is this classically associated with? A, transposition of great arteries. B, tetralogy of Fallot. C, tricuspid atresia. And D, pericardial effusion. What is this classically associated with? This is for team C. What is this X-ray associated with? Transposition of great arteries, B, tetralogy of Fallot, C, tricuspid atresia, and D, pericardial effusion. Please give your answer. Team C, your time is almost up. Team C, please unmute. What is the answer? The time is over.
Pass.
Okay, the time is over. You won't be getting any marks. There's no passing in this round. Okay, so now we go to team. The answer was pericardial effusion. The answer is pericardial effusion. Okay, now we move on to the next team, team D. Team D, please choose your question.
6.
6. Question number 6. Okay. Look at the ECG carefully. What is the diagnosis? Option A, non-sustained ventricular tachycardia. Option B, atrial flutter. Option C, atrial fibrillation. Option D, ventricular fibrillation. What is the diagnosis?
B, atrial flutter.
The answer, you have said the option B, right? Atrial flutter. Okay. The answer is correct. It is atrial flutter. Now we move on to team E. Kindly choose your question.
Question number 4.
Team E.
4. Question number 4.
Question number 4. A 75-year-old male with history of slowly progressing asymptomatic ulcerated lesion over the cheek. What is the diagnosis? Look at the figure carefully. A, squamous cell carcinoma. B, basal cell carcinoma. C, Merkel cell carcinoma. And D, a melanotic ulcer.
Basic cell carcinoma.
Team E, have you answered? Please say clearly.
Basal cell carcinoma.
Basal cell carcinoma. Okay. Answer is correct. It is basal cell carcinoma. Now we move on to team A. Please choose your question.
Question number 2.
Question number 2 for team A. Look carefully at the ECG. What does this suggest? A, right axis deviation. B, left axis deviation. C, bundle branch block. D, right ventricular hypertrophy. What does this ECG suggest? To team A.
Left axis deviation.
Okay. You have said left axis deviation. And answer is correct. It is left axis deviation. So after the second round, the total points for team A is 40. Team B has scored 5. Team C yet to score. Team D has scored 20 points. And Team E has scored 10 points.
Hello, Team E.
Hello, Team
Can you
E.
see it? You have
Hello?
written the message video stuck. Is it visible to you? Hello, Team E.
No, madam.
Can you swipe a screen?
It's not moving.
From left to right or right to left, you have to swipe a screen. If you are joined from your mobile phone.
Not visible, madam.
Ma'am, I have shared the screen recording in WhatsApp group. Jisha ma'am, can you forward it, ma'am? Team E, right now what you are exactly showing in the screen?
Select rounds.
Okay, now it's perfect visible. Okay.
Yes.
Okay, now I hope it's visible now, Team E.
Yes,
Yeah.
ma'am.
Okay, okay. So now we move on to round 3. This is an interesting round. Round 3 starts from Team C. You can choose your question number. 10 marks for the right answer. No options are provided. There is no negative marking. If a team cannot answer, the questions will be passed to the next teams. And the next team also gets 10 marks each if answered after passing. I hope it's clear. We start from Team C. You can choose a question as before. 10 marks for the right answer. No options, no negative marking. And you can pass the question and the team who answers it will get 10 marks. Okay? Okay, now so Team C, please choose your question.
Question number 2, ma'am.
Question number 2 for Team C. A 2014 Bollywood movie directed by Shonali Bose. This movie is an exceptional portrait of a teenage girl with cerebral palsy discovering what she wants and how to get it. She is not defined by her disability, and the movie treats her as a whole person for whom her physical condition is only part of who she is. The image shown has a clue to the name of the movie. What is the name of the movie? Team C. What is the name of the movie? You have 30 seconds. Your 30 seconds is about to finish. Do you want to answer? Team C, do you want to answer?
Pink.
What? You will pass the question. Okay. We'll pass on to the Team D, to the next team. Team D, do you want to answer? Please say yes or no.
Barfi.
What?
Barfi.
Barfi. No, that's not the answer. Team E, do you want to answer? Team E? Okay, Team E doesn't want to answer. Team A? Team A, do you want to answer?
Gabi.
I'm sorry?
Gabi.
No. Team B?
Margarita with a straw.
Yes, that is the correct answer. It is Margarita with a straw. So Team B has answered it correctly. The answer is margarita with a straw. Okay. Next direct question to team D. Please choose your question. Team D.
One.
Question number 1. Okay, team D. Okay, question number 1 to team D. 5 Feet Apart is a 2019 American romantic drama film directed by Justin Baldoni. The two teenagers, Stella Grant and Will Newman, both have an autosomal recessive genetic disorder which affects the reproductive, gastrointestinal, and integumentary system. They must not get closer than 6 feet to prevent cross-infection. In medical parlance, it is known as the 6-foot rule for this disease and is strictly followed in hospitals in the West, where it is more common. Will and Stella fall in love but can't get closer than 6 feet of each other. What is the disease the two teenagers suffer from? To team D. Your 30 seconds has started.
Pass.
Okay, the question has been passed. Team E. Do you want to answer? Team E.
Pass. Pass.
Okay, team A.
Cystic fibrosis.
Yes, the answer is cystic fibrosis. Okay, now direct question to team E. Team E, please choose your question.
Question number 2.
Question number
2.
2. Question number 2 has already been taken. Question number 1 and 2 are taken.
5.
Question number 5 for team E. Morgan Freeman, in an interview about a movie he narrates, Dolphin Tale 2011, Freeman says that the secret to improving sound quality of your voice is dash. According to him, this relaxes the vocal cords. When your vocal cords are relaxed, your voice tends to drop, and in his opinion, the lower your voice, the better you sound. Does that mean he dash a lot? And how does one dash on command? I guess you possess that kind of ability when you play the voice of God. So fill in the blank. The same word fills all the blanks. Team E. Your time has started. The secret to improving sound quality of your voice is dash. Team E, do you want to answer?
Sing.
Team E, I can't hear you. Team E?
Singing.
No. The question is passed to Team A. Team A, do you want to answer? Team A?
No, ma'am. Pass.
Okay, Team B? Pass? Okay, Team C?
Ma'am, pitch.
No, that is not the answer. Team D?
Pass.
Team D has also passed, right? Okay, I'll say the answer. The answer is yawn. Okay. Now, team A, please choose your question. Team A.
4, ma'am.
Team A has chosen question number 4. Okay, question number 4. American diplomats, spies, and other officials have reported symptoms in nearly a dozen countries, starting in a neighboring country in 2016 and expanding to China, Russia, Uzbekistan, and more. Symptoms include headaches, dizziness, cognitive difficulties, tinnitus, vertigo, and trouble with seeing, hearing, or balancing. Many officials have suffered symptoms years after reporting an incident, while some have been diagnosed with traumatic brain injuries. Adequate scientific explanation has not yet been proven. The above has been named the X syndrome after the place where it was first reported. What is X? Named after the place it was first reported. What is X? Team A.
Zika, madam.
No, that is not the answer. Team B. We'll pass the question to Team B.
China syndrome.
No, I'm sorry. Team C. Team C, do you want to answer? Okay, Team D. Team D, do you want to answer? Okay. Team E.
Philadelphia syndrome.
No, that is not the right answer. I hope I have called all the teams. Okay. So the right answer is it is Havana syndrome. Okay. It is Havana syndrome is the right answer. Now, Team B, please choose your question.
Madam, either question.
Which all are left, ma'am? We're not really sure.
3 and 6 are left. Question number 3 and 6.
6.
Okay, question number 6 for Team B. My Own Country, a book published in 1994, made that year's New York Times notable book list. It is used in colleges and medical schools throughout North America and across the world because of the way it communicates the sense of empathy and compassion. The book traces the story of a young infectious disease physician in the mid-80s in Tennessee who began to treat patients with a then unknown disease. Name the disease. To Team B.
Don't show AIDS.
Madam.
Yes,
AIDS.
Team B?
AIDS.
AIDS. Okay. Answer is correct. It is AIDS. Okay, so now we have finished with round 3. So the score is like this. Team A has scored 50 points. Team B has scored 25 points. Team C yet to open their account. Team D 20 points. And Team E 10 points. Now we move on to the last round.
Madam can't see the screen.
Can you see? Is it visible now? Is the screen visible to all the teams? Okay, round 4.
Madam,
Yes.
we can't see, ma'am.
Which team?
Team E.
Team E, ma'am.
Team E.
Our network issue.
I think there is some network issue. Can you try swiping?
Team E, can you rejoin the meeting?
We'll wait for team E to rejoin.
Otherwise, you can join from another device.
Now it's visible.
Okay, team E, is it okay now? Is it visible?
Yeah, visible.
Yeah, okay. So now we move on to the last round, round number 4. Please remove your mask. I request you kindly to remove the mask. Okay, round number 4 starts from team D. You can choose your question number. Each question has 2 parts, part A and part B. On answering part A, you will be given the chance to answer part B. First part will fetch you 10 points. If you answer the second part correctly, you will get 10 points. 5 points will be deducted if the answer is wrong for both A and B. Okay? If a team cannot answer any part, the question will be passed to the next team, either both parts or part B alone. The next team gets 10 marks for answering each part correctly, and 5 marks will be deducted if the answer is wrong. You can also choose not to answer, because if you answer incorrectly, minus 5 points will be taken from your points. So I hope it is clear. You can choose not to answer any part A or part B, if you find it very difficult. Only if you answer part A, the part B of the question, you will be able to answer. Okay? Okay, now we start with team D. Team D, please choose your question.
4.
Question number 4, right? Okay. A 68-year-old man with a history of severe COPD, FEV1 less than around 1 liter, less than 25%, and chronic carbon dioxide retention, baseline PCO2 58, presents to the emergency room complaining of worsening dyspnea and an increase in the frequency and purulence of his sputum production over the past 2 days. His oxygen saturation is 78% on room air. Before he is placed on supplemental oxygen, a room air arterial blood gas is drawn and it reveals pH as 7.25, PCO2 as 68 millimeter mercury, PO2 48 millimeter mercury, and bicarbonate level 31 milliequivalent per liter. Part A, interpret the ABG. Interpret the ABG.
Respiratory acidosis.
Sorry?
Respiratory acidosis.
Respiratory acidosis. Is that your answer? Is that your complete answer?
Compensation.
What?
Decompensated respiratory acidosis. Decompensated respiratory acidosis.
What compensation?
Metabolic
You have to
compensation.
answer it completely, then only you will be given points.
Metabolic compensation.
Fully compensated.
Partially compensated respiratory acidosis.
Respiratory acidosis with partially compensating metabolic.
Okay, what is the answer?
Respiratory acidosis with a partial metabolic compensation.
Yes, correct. Yes, that is the right answer. Okay. Now, part B, do you want to answer part B?
Yes.
Yes.
Give 2 examples of increased anion gap metabolic acidosis.
Diabetic ketoacidosis.
Okay.
Lactic
Lactic
acidosis.
acidosis.
Yes. Yes, the answer is correct. Okay, team D. Answer to part A is primary respiratory acidosis with compensatory metabolic alkalosis, and diabetic team, and part B, diabetic ketoacidosis, lactic acidosis, and aspirin overdose. These are the, so you have answered it correctly, team D. Now we move on to team E. Team E, please choose your question.
Question number
Team E is not visible. Ah, yes, team E.
Question number 2.
Question number 2. Okay, question number 2 to team E. Look at the diagram carefully. What is the diagnosis? The diagnosis. Team E. Team E. What is the diagnosis? Shall we pass the question? Team E. Okay, we will pass the question to team A. Team A, do you want to answer?
Lish noodles.
No, that is not the right answer. -5 will be deducted. So next, team C. Team B. Team B.
Sunflower cataract. I mean, sorry, sunflower cataract, Wilson and galactosemia.
What is the diagnosis?
Sunflower cataract.
Sorry, that is not the right answer. Team C. Do you want to answer? Team C.
Pass.
Okay. Team D.
അല്ല കേഫ്രിങ് ഇങ്ങനെയല്ലടാ നല്ല ഇമേജസ് വരുന്നത്.
Team D. Do you want to answer?
കേഫ്രിങ് ആണോ മാഡം?
Your chance is over, Team B. Now it is for Team D.
Personal.
Okay. I hope I have come to all the teams. Okay. So nobody has answered it. The answer is A. Rubiosis iridis. And the 2 causes of the condition are diabetic retinopathy and CRVO. Okay, so next is to team team A. Team A. Team A. Please
Question number
choose.
5, ma'am.
Question number 5 to team A. An 18-year-old female presents with a painless 1 centimeter mass in the anterior neck. FNAC taken revealed fluid contained with pseudostratified columnar epithelium. What is the most likely diagnosis? Team A, what is the most likely diagnosis? Pseudostratified columnar epithelium. Your time is running.
Thyroglossus.
Yes, that is the right answer, thyroglossal cyst. And part B, do you want to answer? What is the treatment? Do you want to answer?
Trunk operation.
Cyst trunk operation, yes. Both the answers are correct. So full points to team A.
The team B.
It is thyroglossal cyst and cyst trunks operation is the treatment. Now we go to team B. Please choose your question, team B.
Question number 4.
Already taken.
Already taken.
Oh,
Now we have 1, 3 and 6.
1.
Okay.
Okay.
Okay, question number 1 to team B. Part A,
Hearing loss.
diagnosis. Look at the figure and give the diagnosis.
താഴെ കിടക്കുന്നത് സെൻസറി ഐ തിങ്ക് ബോൺ കണ്ടക്ഷൻ ഓർഗൻ പിന്നെ സെൻസറി ഹെയറിംഗ് ലോസ് പറയട്ടെ അല്ലേ ഇത് താഴെ അതെ 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 ആ 2000 ഡിപ്പോ വരുന്ന മറ്റേ ഒരു പ്രത്യേക ഓട്ടോസ്ക്ലീറോസിസ്.
Team D, please mute yourself. Team B, please tell the answer. Do you want to answer?
Autosclerosis.
Autosclerosis. No. No, that is not the right answer. Team C.
Conductive hearing loss.
Yes, conductive hearing loss. Conductive hearing loss is the right answer. Do you want to,
2000 ഡിപ്പോ.
do you want to answer part B?
Yes, madam.
What was the answer?
Rini is positive, madam. Rini
Team B.
positive.
How will you comment on Rinne's and Weber's test for this diagnosis?
Rini positive, madam.
Weber?
Weber lateralized to the poorer ear.
Okay, the answer is not correct. We pass the question to the next team, team D. One second. 1 second. Some network issue. Please give a few seconds. Dear team C, your part A is correct, but part B is not fully correct. So we pass this question to the next team, team D, second part. Second part we pass on to the team D. Do you want to answer?
Yes, ma'am.
Vapor will be localized to the air with a conductive hearing loss. As bone conduction is more than air conduction,
What about Rini?
Rini will be negative because bone conduction is more than air conduction.
Okay. Team D has answered it correctly. Rini will be negative and Weber will be lateralized to the affected ear. Okay. Okay, now we have question to team C, direct question to team C. Please choose your question.
3.
Question number 3 to team C. Okay, a 24-year-old Nulli gravida woman comes to your OP with an 18-month history of cyclic debilitating pelvic pain related to her menses. Her menses is irregular but heavy. On pelvic examination, there is a normal-sized immobile retroverted uterus with nodularity and tenderness on palpation of the uterosacral ligaments. Part A, what is the most likely diagnosis?
Pelvic inflammatory disease.
Sorry, team C.
Madam, pelvic inflammatory disease.
I'm sorry, the answer is wrong. We pass to team D.
Endometriosis.
I'm sorry, team D.
Endometriosis.
Can you say loudly?
Endometriosis.
Okay, endometriosis is the right answer. Then part B, do you want to answer? How can you establish a confirmatory diagnosis in this condition? Team D, do you want to answer? Team D. Team D, video is stuck, I think. Team D, can you hear?
Team D has left the meeting. There might be some network issue.
Okay, we will wait for a few seconds for them to rejoin.
Just join.
Okay, team D has joined back. Can you see team D?
Yes,
Yes,
ma'am.
ma'am.
Yes,
Do
ma'am.
you want to answer the second part? How can you establish a confirmatory diagnosis in this condition?
Yes, ma'am.
What is it?
Laparoscopy. Diagnostic laparoscopy.
Yes. That is the right answer. Team D has answered it correctly. Part A is endometriosis and part B laparoscopy. Okay, so now we have come. So I hope I have not left any teams. So we have come to the end. Please wait for some time to get the final result. We are calculating the score. We will tell the final results in few minutes. Please do wait. So we have the final score. At fifth position, we have Team C, Dr. Ashwati and Dr. Navina with 5 points. And fourth position, we have Dr. Jitin and Dr. Aparna from KIMS Health with 10 points. At third position, we have Dr. Minnu and Dr. Anakha from Lutz Hospital, Kochi with 15 points. And at second position, we have Dr. Nasiba and Dr. Fatima Lefna from KIMS Health, Trivandrum with 65 points. And the winners are Team D, Dr. Labiba and Dr. Krishna from Medical Trust Hospital with 70 points. Congratulations to all the teams. Kindly switch on your videos. We really appreciate your participation. Nobody is the loser here. And congratulations to the team with the maximum number of points, that is Dr. Labiba and Dr. Krishna from Medical Trust Hospital, Kochi, with 70 points. The second position to Dr. Nasiba and Dr. Fatima Lafna from KIMS Health with 65 points. And the third position to Dr. Minnu and Dr. Anaka from Lutz Hospital, Kochi. So I thank all the participants. You will all receive the prizes soon. So okay, so now we will wind up the quiz. Thanks to all the teams. And let me announce the prizes. The first prize is gift vouchers worth rupees 5,000. Second prize is gift vouchers worth rupees 3,000. And third prize, gift vouchers worth rupees 2,000. So once again, congratulations to all the winners and to those who participated in the quiz. We can log out now and join back sharp at 4 p.m. for the PG update. So thank you one and all. Thank you.